Careblazer, I am so excited for you to listen in on today's interview. I chat with Adria Thompson. She's a speech therapist, and she talks about just all of the wonderful things that speech therapists can do for dementia care. She also talks about the wonderful things occupational therapy and physical therapy can do in dementia care. I have worked personally with amazing speech pathologists, occupational therapists, and physical therapists in my dementia care work, and I think they are an important piece to really great dementia care. If your loved one has dementia and nobody has talked to you about what speech pathology can do, or occupational therapy or physical therapy, you do not want to miss today's interview. Plus, she talks about how the challenging, difficult dementia behaviors that you're having a really hard time with, how speech therapy can help solve for and understand what is the person with dementia really trying to communicate here. I love this interview. I think Adria Thompson's doing great work, and I'm excited to hopefully open up a whole door for all of you to talk to your loved one's providers about getting speech therapy, occupational therapy, and physical therapy involved for your loved one. Let's dive right in. Adria, welcome. Thank you so much for being willing to take some of your time to speak with Careblazers on speech language pathology, how important it is, what it is. I think this is going to be such a helpful video. But before we jump into all of that, can you take a brief moment to introduce yourself and how you're involved in the world of dementia?
Sure. Thank you so much for having me. It's really an honor to be on your channel. So my name's Adria. I'm a speech language pathologist. I've been doing this for about 8 years now, and I have been working in skilled nursing facilities and assisted livings over the last 8 years, providing speech therapy interventions for individuals with dementia. Also, on a more personal note, my grandmother has dementia, so I really started over the past, I would say, 4 years, really seeing through what my mom was going through as the main caregiver for my grandmother, how much support is needed to understand not only what dementia is, but how we can better care for individuals with dementia. So I really started to see my role as a speech therapist and realize that I can provide a lot of insight in that area. So in September, I started Be Like Care Consulting, which just allows me to train therapists, other occupational, speech, and physical therapists, and the best practices for caring for individuals with dementia. And I make a lot of fun videos about dementia on TikTok and Instagram. So it's been a fun adventure so far.
I love it. Okay, so tell us, what does speech language pathology have to do with dementia? What are the different things they can do? Why is this area important for dementia care?
So as a speech language pathologist, I always explain my services as I help people with communication, swallowing, and memory. So as far as communication goes, I deal in all aspects of communication: receptive language, which is understanding what other people are saying to you, and expressive language, which is us verbally typically communicating to others. Also involved in communication is nonverbal communication. So a lot of times individuals with dementia are using a lot of nonverbals to communicate, and that can look like resistance or combativeness sometimes. So I look at what are they communicating and how are they doing that? And then how are we as caregivers kind of compensating for the things that they can't say and meeting their needs even when it's not super clear. So that's communication. For swallowing, a speech language pathologist diagnoses and treats all deficits in swallowing, which is also called dysphagia. So if someone is getting choked frequently or coughing during a meal, having a hard time chewing, we are the ones that determines what diet someone should be on, how soft or how hard food should be, if liquids need to be thickened, things like that. And then for memory, I say memory, but it's usually, it's really all areas of cognition and thinking. So we can do cognitive assessments to determine, what executive functioning skills they have, which is all of those planning and organizing skills. Also, of course, memory, we can determine what deficits they have in either short or long-term memory. And then just any other thinking process, attention, just focusing on things. So we do a whole lot, and all of those areas are deficit a lot of times when someone has dementia.
Absolutely. Now, I come from the world of psychology, geropsychology, neuropsychology. I've done a lot of my years when I was in the hospital actually assessing for dementia. Can you speak to the differences between what a speech pathology cognitive assessment might look like versus a neuropsych assessment? Because I think most people are more familiar with, like, if you're going to get a traditional diagnosis, you would go to neuropsychology.
Sure.
But there's some overlap there.
There is overlap, and sometimes we might actually be doing the same tests. But a good rule of thumb for someone who, for a speech pathologist, is we're looking at cognitive communication disorders. So how cognition is impacting communication. And so we can do tests, if you've heard of the SLUMs, like the St. Louis University Mental Status Examination, the mini mental status examination. These are all things that might be done in a neurologist's office or a neuropsychologist's office. But speech therapists, we use these same tools. And the way that we're going to use them is we want to find the deficits, the neurological underlying impairments. So not just what they're not able to do, but why they're not able to do it. And then with that information, we're going to trial a ton of interventions. And what I mean by that is just, we're going to try a bunch of stuff and see if it works. And if something works, that means that it's going to improve their function. Although you might be more used to a clinical neuro kind of testing, that's going to be a lot of assessment. Yeah. But for a speech therapist, we're going to do those same things, but it's going to be all tied into the interventions that we provide later.
Can you speak specifically into just how important and some of the great findings and insights and what a big difference speech pathology can have when it comes to helping somebody communicate? Like, I'm sure you have some examples of family members or even staff not really understanding why somebody is doing something that doesn't quite make sense to us, but through assessment, through like the speech pathology, critical evaluation, like you're able to come up with solutions and help that person communicate and help other people understand what that person is trying to say.
Yes. So I'll give a good example. We'll call her Mary. So with Mary, what I do in my assessments, we usually think of like the very first visit, but for someone who is a therapist, we're treating and having sessions with people sometimes multiple times a week, especially if they're in a place like a skilled nursing facility. So we're assessing all the time. But for Mary, I wanted to see what she is able to verbally communicate and how accurate it is. So I'm going to ask her yes/no questions, and I'm going to actually tally and determine the accuracy level of her yes/no answers. So she might say, are you hot? She might say no. Well, can we even though, yes, she can participate in that communication exchange, is it accurate? Is it something that we need to actually put a lot of, emphasis on? So for Mary, she was verbal, but she was not very accurate. And just to give you kind of a glimpse into what that might look like is, I can say, are you hungry? Are you thirsty? Right. Are you tired? And she can tell me yes, no, but I don't know if that's accurate or not because I can't tell what she's feeling. But I'm going to say things like, is my shirt blue? Are you a man? Is your name Philip? And so I'm going to ask questions that have concrete yes, no answers that are actually accurate or not accurate. And we can decide from there how much we can really put stock into what she's saying. So I determined that her ability, although she was very verbal, to express her wants and needs accurately is not fantastic. And so what that tells me is I need to train the staff to not only listen to what she's saying, but look at what she's doing. So if she's in the shower and she's feeling the water and they say, does this feel good? And she says, yes, but her face is like this, then we probably need to change something. So with Mary, one problem, I think I have a video on this recently on my TikTok and Instagram. but the biggest problem they had with her is that she would not sit down on the toilet. And so they would take her, she would say she needed to go to the bathroom. She was accurate in that. But when they would take her in there, she would turn around in front of the toilet. She would pull her pants down, but she would not sit. And so they were physically having to put pressure on her shoulders and do all these like tactile cues that we call to kind of, Mary, sit down. And she would just fight. And she would, her communication was, no, but we couldn't understand, okay, she knows she needs to go, what's happening? And so as a speech therapist, I always train my other therapists is ask the caregiver, what is hard in caring for Mary, for example? And they're always going to say, well, it's toileting. So that's what I'm going to do in my session. So I took her to the bathroom several times within a week, and I was experiencing this same thing. And I had this one moment where I was like, I need to pay attention to her nonverbals. I'm training all the other staff that this is what we need to do. So I need to really tune into this. And as I'm walking her, I'm making a concerted effort to get in front of her and observe what she's doing. A lot of times we walk with people, we're behind them. And I noticed when she's getting close to the toilet, she was going, ugh. She said one day, it was like, ick, I think is what she said. And she was making these faces. And I thought, well, why might she feel that way? And how might that affect her ability to sit down? And it hit me all of a sudden. She thinks the toilet seat is dirty. Mm-hmm. And so I just went with this hunch, and I got a wet wipe and I wiped the toilet seat down right in front of her. And then I said, okay, Mary, go ahead and sit. And she turned and sat with no problem. And so it's just things like that of analyzing her communication abilities, her accuracy levels, and really paying attention to those nonverbals to realize, there are some people who do not sit on toilet seats. And she is a hoverer in public. And so I told her daughter this, that I found out, and she said, well, she never did that at home. And I was like, but it was her own toilet. And we don't, people don't do that to their own. So I just trained staff, wipe the toilet seat down before you set her down. And every time she would consistently do that. And it had been right when she moved in that this was a problem. And after a few weeks of this, we didn't have to wipe the toilet seat down anymore because it felt like hers and it felt familiar to her. But until then, this is a public restroom and she was not sitting down on that. And so that's just a good example of how analyzing communication is really important to figure out some of these problem situations.
I love it. I love so much about what you just said. And it shows that what people with dementia are doing is always communicating something, right? And to us, it does not make sense a lot of times, but I love the approach of like, you have to be willing. I talk about it in terms of like, what's your detective mindset? If you're a detective, like what could this behavior possibly mean? Do not limit yourself. It doesn't have to make much sense to you. It just has to make sense to them. And I love it because the approach is like you said, you worked with her for weeks, like trying to figure it out several times a week. Like, it's like, there's something they're communicating. Just be open to like maybe it's that aha you get. Maybe it's like paying attention to like the nonverbals or the word ick or whatever, like what could all of these things possibly mean in that situation? And I love it. It shows that the approach, the solution, even for like the best professionals, isn't always like you're going to get it on the first time. It's like, it's a trial and error. And we can be like, every time you get feedback that maybe your approach didn't work, that's okay. That's actually feedback. Well, it wasn't that. Like we can rule that out. Like I love, like, this is a mentality I try to share with a lot of my Careblazers and those in the care course. It's like, no, like, that's great. Now we know we can rule this part out. What's next on your list? What else can we try? And keeping that open mind, but always with the idea, like they are communicating this for a reason. Let's try to figure it out.
I always train my therapists that everything they do makes sense to them. Yes. Like if you operate from that perspective, like it definitely doesn't make sense to us, but in their world and in their reality, this behavior is perfectly acceptable. And so we kind of just have to flip things on its head and say, okay, in what situation is it appropriate? And in that example, like when is it appropriate to just not want to sit on a toilet seat?
Right.
And it's because it's disgusting.
Right.
So it makes perfect sense once you got into her world. But in our reality, it's like, well, this is her private bathroom. No one else is using it. It's perfectly clean, but it doesn't matter in her world. So yeah, it's my favorite part of my job. And I think no matter how much I like consult and work in this kind of training capacity, I think I'm always going to want to be a speech therapist and like at least part-time and still treat people, because it's really important to stay in that mindset and like actively be trying things, because it is so rewarding. Like you said, there's so many times we found out what doesn't work, and that's just as important, because we don't want to waste everybody's time trying all the things that we already know is not going to work.
Right. Yeah. And the big lesson too was like nowhere in this whole process was Mary trying to give the staff a hard time. Right.
Yeah.
Like, they're never like trying to give us a hard time. It's just that for some reason, this is making sense in their mind, and we have to try to figure out what it is that makes sense about it. I love that approach. When I talk to care course members, and I'm in a live Q&A, and sometimes they'll say things to me and it's about communication. And I'm like, have they had an assessment by a speech pathologist? Like, I'm so shocked at how many people don't even realize like speech pathology is an important role in dementia care. What do you make of this? Like, to me, when I worked in an assessment clinic, I would be doing a lot of the, neuropsych, more comprehensive testing, like beyond a slums or MMSE.
Mm-hmm.
But like the speech pathologist, not only would they do like a swallowing eval, they would also be doing like some basic comprehension testing, and they would be able to give specific recommendations on here are some best communication tips. And even for some people, like picture books or communication boards, or what, depending on their level of cognitive impairment, there were so many ideas to help facilitate communication. And I'm quite shocked at, outside of the hospital setting, a lot of people don't realize like this is a very valuable discipline. Do you see, maybe you don't see it because you are speech language pathology, but do you see this, or have you heard of this?
No, I know exactly what you're talking about. And honestly, that's like what has propelled me on this journey of training other therapists, because I'm a big advocate for myself. And in any facility I work in, I am like putting my nose into every business, because I know that I can have an impact on the kind of care someone's being provided. But therapists, I think, one aspect is that therapists are not advocating for their own services and how much we can help in those areas. I think another aspect is that a lot of therapists, not just speech therapists, but a lot of therapists in general, do not feel comfortable working with people with dementia, or don't exactly know how to make it functional. And as a therapist, one thing that's unique to us is that we bill Medicare, like we bill insurance. And so we have to document everything we do, and we have to show progress, and we have to just constantly reaffirm the fact that our services are needed and it's having a positive impact. But therapists, when they look at people with dementia, they're like, well, they're not going to make progress. Like, they're not going to get better. But one thing I really want your Careblazers to know is that we're not always just in the business of rehabbing, like restoring lost abilities, but maintenance is really important too. And so maintaining someone's skills for as long as possible is critical. And it can make all the difference in the world. And so I think therapists aren't advocating for themselves. I think that they aren't always necessarily comfortable. But also, like, other medical professionals don't know to get us involved too. And so I really hope, like, in anecdotal things, I'm getting messages myself of like, I had no idea speech therapists do what you're doing. And so if I can just help change that perspective and just getting us involved in the conversation, like, I would be so happy at the end of the day if that could at least just happen. So yeah, caregivers and your Careblazers, they can advocate for their loved ones with dementia during a doctor's appointment. Like, hey, I've heard that a speech therapist can help. Can I get a referral for that? Like, can we get that started? Some states require a referral from a doctor, and others don't. So kind of just ask in your state what that would look like, but ask for it because it's definitely not going to hurt.
Right.
And insurance pretty much always covers it. So
yeah, I think there's a lot to be said about just the improvement of quality of life, not necessarily like lengthening the life or like reversing anything, but it's like, to think about Mary struggling every single time she has to go to the restroom versus no longer struggling. That's huge, right? And also the demand on staff and the time and resources, the drain that it would take for staff members to constantly, I can see like staff members trying to do the same approach over and over again, just wishing Mary would comply or sit, and it's
yes.
challenging and heartbreaking all around when it's like, well, like, let's figure out where does this behavior make sense? Why might she be doing this? Like, let's figure it out. And that's where obviously you come in. And I think it's wonderful. Does every nursing home, residential facility, or memory care facility, do they all have speech language pathology there or speech therapists on their staff?
Good question. Most of the time in skilled nursing facilities, you're going to see a speech pathologist on site in some capacity. I know from experience that sometimes a building might not have their own speech language pathologist, but they might borrow from another building. So I covered 3 buildings at one time. And you'll hear me say speech therapist and speech language pathologist. It's all the same thing. So if that's a confusing thing. So most skilled nursing facilities, a speech therapist is going to be part of the rehab team with the occupational and physical therapist. Now for assisted living communities, they cover those needs in a variety of ways. So in the assisted living facilities I have worked in, we contracted with the assisted living company. So we didn't work for them, but we had an office inside the building and we provided what was called technically outpatient therapy. So because all of these individuals had apartments, we're essentially just, they could come to our office. And although it was just next door, it was considered outpatient. They also contract with home health companies. So home health therapists can come in and once again, because this is their apartment and they are living in their own apartment, we can do home health therapy and actually come into their apartment. So I actually was contracted with a home health agency and outpatient. So just based on which insurance I was billing, I was either providing outpatient or home health, but I was doing the same thing.
Awesome. And can you speak to, because, therapists of all different kinds of backgrounds are so important in dementia care, to the extent that you're able, can you share a little bit about how occupational therapy or physical therapy and speech therapy all can kind of come together to really be a great team adjunct for somebody with dementia?
Absolutely. So occupational therapy, they help with activities of daily living. So things like toileting, dressing, brushing teeth, all of those kind of things. They are experts in that area and they can help problem solve. And they also deal with cognition. So as a speech therapist, I might be looking at cognition as it relates to communication. Occupational therapists are often going to be looking at how cognition relates to function in those activities of daily living. So they are going to do all of those tasks. They can help problem solve how to get someone in and out of the shower easier, what kind of assistive devices or, like grab bars need to be in, or a non-slip mat. They are experts in all the little gadgets and cool things that can go on around the home. Home assessments are something occupational and physical therapy share. So they can kind of come in to someone's home through home health therapy and help you rearrange things and make it to where people can be safer. So occupational therapy is more assisted activities of daily living, super helpful, intelligent, wonderful people. Physical therapy, as is the most commonly known, they help with ambulation, so getting around, strength and mobility, and they can also help manage pain, which I think a lot of times we don't really think about. So they can help with any kind of chronic or acute pain. And so they can come into the home also or go outpatient and just help sustain function, maintain function. One thing that I think is really cool that physical therapists can do is help in fall recovery. And I think that is something that's not implemented in the home enough. And so they can come in and put your loved one on the ground safely, and then teach you and them skills on how to get them back up. And even just things like securing furniture to the wall so that if they try to grab onto the nightstand or a dresser, it doesn't fall on top of them also. So many unique just perspectives that therapists can help with. And when someone is in a community like an assisted living or in a skilled nursing facility, the power of us all working together is so, I mean, it's my favorite thing. I love collaborating with other therapists. One of the videos that kind of took off the most for me was a video about decorating a walker. And I do this with my physical therapy friends all the time. So they might request that someone with dementia is to use a walker when before they didn't. I have assessed that they are not really capable of learning new things very easily anymore. So I'm going to work alongside with a physical therapist, and I will trick out the walker. I will make it look beautiful so that their visual attention, number one, is drawn to it. And then also I can use some things called like spaced retrieval training, which is a memory strategy to help them remember their walker. And so when you have multiple therapists working with the same person, we can collaborate like that and just knock problems out the park. It's really fun.
Yeah. And I think it speaks to like any good dementia care is going to be interdisciplinary. It is going to involve more than one discipline. And I love this whole conversation because it really shows there is a lot that can be done. Like, okay, we're not at the point where we can cure dementia or take it away. And we're not even talking about like reversing it or increasing the length of their life, but we're talking about improving their quality of life, being able to communicate with them better, keeping them safe, keeping the caregiver safe so they know how to pick somebody up, or making the home environment safe, doing a home safety eval. There's so much that can be done in dementia care that I feel like for some reason is not talked about a lot, because when I bring it up, it's like news to a lot of people.
Absolutely. And like we said before, you just have to advocate for those kind of those services because a lot of times you might know more about that than the physician that's seeing them, of all the different possibilities. And I really, like I said, a lot of therapists might not feel comfortable working with people with dementia. So if you get a therapist that kind of comes into your home and really doesn't know what they're doing, it's the same thing. I mean, you can go to a physician that doesn't feel comfortable working with people with dementia, or a nurse, or a grocery store person. Like, there are people who just get it and people who don't. And so if you've had a bad experience or just an okay experience with a therapist in the past and you think, well, that didn't do any good, right, it's worth trying again, because there are so many things that we could do. And I hope that you find a real good therapist that will work with you and help you problem solve.
Yeah, I love it. It's the message of like, try again and try again and try again, whether it's like figuring out what a behavior is about, getting the right therapist involved, getting the right, physician, referral, whatever the case may be. I see it a lot with Careblazers finally taking the leap to get respite care, to get like a home health aide to come in, and then it doesn't go well. And they're like, this doesn't work. I'm like, try again. There might be somebody else out there. But it's a good message too, that like, just because there are psychologists out there, speech therapists out there, physicians, occupational therapists. We're not all trained in dementia care. It's very few people actually get that specialty training. So it's like understanding that just because the initials are the same doesn't mean it's equal to the same care.
Absolutely.
Yeah. And I love, even though like you're working in a memory care setting or residential care?
I'm in skilled nursing currently.
Okay. Mm-hmm. Yeah. So, but this can be done on the outpatient side as well.
Yes.
So just whoever, like whether your loved one is currently in some sort of residential care setting or an outpatient care setting, if you think that these therapy services can be helpful, which the answer is yes, that's in some way, all of these therapies can be helpful. Reach out to the PCP, ask for a referral, talk to them about your concerns, and hopefully be able to get some more information. I think the communication is a really big piece. If we can be able to know what, for me, I'm mostly working with the Careblazer. If they can know what their loved one is trying to communicate, things can be so much more rewarding and more connection and so many things.
And I'm all about like individualized recommendations and care, because we can read about these good communication strategies or what you should do with someone with dementia, but I can tell you that like Mary and Bob are going to respond very differently. Right. They might be in the same stage of dementia. They might have the same type of dementia, but you might be able to get down and pat on Mary and love on her. You try to do that with Bob and your head's going to be bit off. Yeah. So I think it's so important to getting a therapist involved really helps individualize that care, because they can come in and say, assess Mary's exact specific limitations and ability levels, and we can make recommendations for Mary in communication, in ADLs, in ambulation, whatever it might be. But learning some general kind of recommendations are wonderful, and every piece of education is important. But just having that personalized person to come in and do all the tests and all the things is so uniquely important.
Absolutely. I love it. If you could have two people the same age, the same type of dementia, the same stage, but even their symptoms are different. Even the way they communicate is different. What they enjoy is different. Like I've had some people who would be totally offended and upset if you tried to give them like a doll or, like a inanimate pet or something. And other people are like carrying it around and loving it. It's like, there is no one approach to everybody, even though they have the same diagnosis. So it is super important. I love this. Thank you for coming on and sharing your expertise. Anything else that maybe I think we've accomplished the goal of like how important speech therapy is, even how important occupational therapy and physical therapy are, and what roles they have in dementia care. Anything else I didn't ask that you think would be super helpful for family members to know about?
Yeah, I think one thing I want to kind of leave you with, I guess, is just because your loved one with dementia hasn't done something doesn't mean that they won't or that they can't. And I think there's a lot of mourning that happens with individuals with dementia, like mourning the last time they played piano, or like they're not able to go play golf anymore. And I think that just because they haven't or they currently can't do something, we don't need to just completely write it off. I get questions a lot of like, well, mom hasn't showered in 3 months. Like, it's just not going to happen. And I can tell you personally, I have showered those exact kind of people that haven't done something in such a length of time. It's all problem solving. And if a therapist can come in and help you to figure out how we can get Albert golfing again, but in a safe way, and still engage in these really purposeful, meaningful things, then why not try?
Right.
That's probably one of the things that I enjoy the most about my job, is helping people do things that we thought was out of reach before. And it's all about just modifications, adaptations, and a lot of times approach. So if any of your Careblazers have any further questions about like what a speech therapist can do, or I'm thinking about like this possible thing, is that something a therapist can do? Feel free to reach out to me, but also just get a referral. Ask your doctor. It's not up to you to determine like which kind of therapist is it. Just let the whole team come in and do some assessments, and then they can kind of pull apart whose responsibility is what, because there's always hope. And we really do want to decrease that burden of care for people with dementia, because there is still joy to be had and still so much life left.
I love it. It's such an optimistic, hopeful message that you're sharing. I also love that you said, like, I think we throw out a lot of things people with dementia love to do because they can't do them in the same way. But we just have to figure out, like, how do we adapt it to not only match their cognitive ability level, but their physical ability level too. Like, you have to be assessing both sides. And then, okay, like, there's probably a way to adapt that activity. They're probably not going to get in the car and drive to the golf course and check out the clubs and drive the golf cart around anymore. But like there's so much in between there. And even as the disease progresses, I like to talk about like, well, they can still keep that activity, but again, you continually adapt. Like we have to continually adapt our approach and how we're engaging with a person with dementia so they can keep that activity level. But yeah, I think if we're just expecting it to always look the same, as soon as they start to have trouble or they can't do that anymore, sometimes we throw that out the window, and it doesn't necessarily need to be that way.
Right.
Yeah, I love that you brought that up. Okay, so Adria, where can people learn more about you?
So the best way to engage with me and see kind of basically day to day what I'm up to, you can find me on Instagram at Be Like Care. I have a TikTok at Be Like Care Consulting, lots of videos there. And then my website is belikecare.com.
Awesome. I will be sure to link to all of that in the description below. I love our communication. I hope we can stay in touch and maybe even have you come on and do more of an intimate, personal, like going deeper with some things, maybe inside for my care course members as a special bonus. We'll have to chat about that. But I just thank you for your time. Thank you for your expertise. And thank you for what you're doing for people with dementia. You truly are improving their quality of life, improving their relationships, and also for everybody who's interacting with those people. So just, you're doing really important work out there. And thank you for being here and sharing that.
Thank you. That means a lot.
Awesome. All right. Bye, Adria.
Bye.